Amyl Nitrite. It is commonly available as a generic, so there's no real trade names for it. It is a cyanide poisoning antidote and is part one of three usually. Usually we give amyl nitrite, it is inhaled, and we'll give it first until we get an IV established and give sodium nitrite and the sodium thiosulfate. The way it works, it converts hemoglobin to methemoglobin, which then binds with the cyanide in the blood and renders it inactive. So it takes that cyanide off the cells and it binds with that methemoglobin. Pregnancy class for it is X. It causes a lot of hypotension, and so, if you're hypotensive with the pregnant females, then it can impede some fetal blood flow, and, at some point you have to make that decision of what's more important, saving mama's life or the baby's life, unfortunately, so keep that in mind. Only thing we're going to use it for is cyanide poisonings. Contraindications, none really in the emergency setting. Whenever we're given amyl nitrate, the patient's usually unconscious, unresponsive. Adverse reactions to watch for: headache, dizziness, weakness, increased intracranial pressure, difficulty breathing. It's going to cause hypotension, tachycardia in response to that, and it can cause syncope as well. And then we also want to be mindful for signs of methemoglobinemia, and that's going to be cyanosis of the lips, fingernails, and or the palms of the hands. Drug interactions: alcohol, beta blockers, phenothiazines, and other antihypertensive may cause an increase in hypotension, and so just something to watch for. Anytime we're giving this, we want to be very mindful of the patient's blood pressure because it will cause a rapid drop. Typical dosing for adults: 1 to 2 ampules crushed and then put on a gauze pad or something, and then you'll inhale it for 30 seconds or have the patient inhale it for 30 seconds, and then follow that up with 1 minute of high flow O2, and then repeat that until you have an IV established and can give sodium nitrite, or the patient regains consciousness, or severe hypotension occurs, like blood pressure 80, 90 systolic, something like that. If that occurs, then we want to stop with the amyl nitrite and just give the high flow O2. Pediatric dosing, pretty much the same. You're going to follow that cycle and take care of that. It starts working within about 30 seconds. Peak effects kind of vary in how long, and then only stays working in the body for about 5 to 10 minutes. So, like we mentioned in the beginning, this is part one of three. It's followed up. Once you get your IV established, you'll give sodium nitrite and then sodium thiosulfate, and you'll pretty much stop using this. So the amyl nitrite. Amyl nitrite and sodium nitrite are pretty similar, just one's given via IV. They work pretty much the same way in the body. So this is kind of an emergency thing for someone who's not conscious, not really breathing very well, until we can get that IV established and treat them that way.